Друзья, всем привет! По поводу невралгии тройничного нерва. Сейчас впечатление по поводу третьей операции от девочки из Канады. Послушайте, очень интересно.
I think the best way to do this is by answering the most asked questions publicly, and then any other questions I'll answer privately. I am going to start with what surgery did I have, how long did that take, what did it look like. So from the time that I went back into the theater to the time that I woke up in recovery, it was about 5 hours. That is a bit longer, but that's because I have had previous surgeries and they ran into some scar tissue. The formal name of the procedure that I had was a right-sided craniotomy with a microvascular decompression and internal neurolysis. It's a bit of a mouthful, but that is everything that was done to me if you want to Google that and look at it. The surgeon started by creating an incision behind my right ear on the affected side. Ideally, once you do that craniotomy, you should be able to visualize the anatomy that the surgeon needs to see. In my case, they weren't able to see the anatomy right away because of that scar tissue, because of my previous 2 surgeries. And so they had to spend some time releasing that scar tissue before they could look at the trigeminal nerve. Once they were able to do so, they proceeded with the microvascular decompression. What that would look like if it was like your first time going through it was they would scan the nerve, the trigeminal nerve, and they would look for any sort of vascular contact or any other thing that might be contacting the nerve, irritating the nerve. They would then try to move that or do whatever they needed to do, and then they would place Teflon to protect the nerve from that happening again. In my case, this go round, I didn't have any vascular contact. They were not expecting any vascular contact. And again, that's because I have had 2 of these already. They've done a pretty thorough job. We know that it's probably happening because of the scar tissue and maybe the mechanism of the nerve itself. And so they still did a scan. They still replaced the Teflon just so that if my offending vessels do come back, I'm protected for a bit longer. So yep, that's all comforting. They did that. And then they moved on to the internal neurolysis. That is where they, at least in my case, there's a couple different ways I think they can do this, but the surgeon placed an instrument into my trigeminal nerve and separated some of the fibers of the nerve to create damage. He did this purposefully. This was talked about in my consultation beforehand. This interrupts the signals going from my face to my brain. Ideally just to stop those pain signals from even happening, stop the sensation entirely. And that is why I have the numbness. If you are going in for a regular microvascular decompression, the numbness that I'm having is not likely to happen to you. And so the internal neurolysis is what is giving me the lack of sensation I'm experiencing and the pain relief that I'm experiencing. So the second most asked question that I'm getting is about the numbness itself. How long will that last? How long is this procedure gonna last? And that's a bit harder of a question to answer. My surgeon specifically did not want to give me a timeline, and that's because I have not responded in a textbook way in the past 2 surgeries. I'm not a textbook case, and so he did not want to set me up for an unrealistic outcome. And I appreciate that. I'd rather have the honesty. With a typical MVD, they might tell you 80 plus, 90 plus % chance, ideally 5 plus, 10 plus years. With the neurolysis, my surgeon had said 2, 3, 5 years, ideally again. I had my Teflon replaced, so If it's a matter of any vessels coming back, anything like that, hopefully I'm protected for that 5 plus 10 plus years. The numbness itself, though, that neurolysis, might only be a couple years. And from what I've read, if I can get past this first year, I can be a bit more hopeful in that regard. But yeah, the first year is a big test. The thing about these is that, again, TN does not have a cure. These are temporary procedures. Nerves regenerate, things move around. And so that is why awareness is so important. One of the hardest things to explain to others, whether they have TN or not, whether they're new to this or not, is that this is not a forever thing. You hope that you have enough time to get your footing, but you really just have to live your life as it comes. It's hard not to let the anxiety of it coming back affect you, but you just go for it and you live, and that is what I'm planning to do. So can't really give a straight answer on how long it's gonna be, but sure as hell gonna try and make the best of the time I do have. So one question I'm getting quite frequently is what the heck happened to my eyeball, because that is not something that typically happens with craniotomies, microvascular decompressions, or neurolysis. So what happened? This was actually an after surgery thing. It's really common with craniotomies to get what they call a post-craniotomy headache. There's a number of reasons why that can happen, but regardless of those reasons, I had one, and it was super positional. So the only way I could kind of manage the pressure in my head was by laying flat on my stomach. At the same time, I had a lot of nausea, which is also really common after surgery. And unfortunately, laying on my stomach was not helping the nausea. It was not a great situation. I got to the point where I needed to throw up. And I think just the pressure in my head, the pressure of being on my stomach, the pressure of kind of needing to tilt my head over the bed to throw up, the act of throwing up itself, it was all just a bit too much for my eye vessels to handle. And so now I look like this. It was kind of freaky. I didn't notice it at first, woke up the next morning and saw it and freaked out a little bit, but it is not hurting me. It's not affecting my vision in any way. I've been told it'll probably go away in about 2 weeks or so. So I just look like a cyborg alien.
Друзья, еще пару слов скажу про эту девушку. Болеет она с 15 лет, сейчас ей только исполнилось 26. Принимает она очень много лекарств, по крайней мере, принимала. Это ее третья микроваскулярная декомпрессия с 15 лет. Понятно, что девочка пережила очень много. Надеюсь, это конец ее страданий.